Bunions are basically a deformity of the big toe joint, and the big toe tends to move towards the outer side of the foot. So you get a large lump on the inner side of the foot. So this is basically a deformity of the first big toe joint. And as time goes by, this tends to progress a little bit, and patients feel, and they're quite often present with a large lump on the inner side of the foot and the toe pointing towards the outer side. As time goes by, quite often the second toe gets pushed away by the big toe. So quite often you end up getting a deformity of the second toe as well. So in the later stages, patients present with the deformity of the big toe and the second toe as well. And most of the problem seems to be related to footwear. Quite often they cannot wear comfortable shoes. The shoes run onto the bunion itself, and quite often the bunion gets inflamed. The technical name for the bunions is hallux valgus. Bunion is basically the soft tissue swelling that you get on the inner side of the foot. Patients present with a lump on the inner side, they say that the front of the foot has become quite wide. The first toe has deformed because the first toe is crowding over to the outer side of the foot, and quite often this produces a deformity of the second toe as well. Because there is not enough room for all the toes, the second toe gets pushed out upwards. So the second toe then becomes a problem as well. So these are the main conditions that they present with: the deformity and inflammation of the bunion from time to time. Occasionally, if they don't look after it very well, it can get infected as well, which then becomes a major problem to deal with. They generally do is simply because once a bunion is formed, there are tendons around the big toe that pull the tendon. So once a deformity is started, the tendons tend to pull the toe in a different direction. So as time goes by, the deformity does become progressive as well. And then, like I said earlier, the deformity becomes to such an extent that it pushes the second toe and sometimes the third toe out of alignment as well. Occasionally, because of the pull of the tendons, the first toe joint can come out of partially come out of its socket as well. And again, that presents a bigger issue. If they are left untreated, they gradually progress over time. And because the problem is associated with the footwear, the shoes rub onto the outer side of the foot and they get inflamed and painful from time to time. And if it progresses far enough, then the skin can break over the bunion as well, and it can get infected. Then they become more difficult to treat as well. And like I said earlier, the second toe also can be deformed as well. And the main problem is generally with footwear. In the initial stages when they are beginning to form, quite often the symptoms can be treated. So people have splints and toe separators that can keep the second and the first toe slightly apart. But that is just purely treating the symptoms. Once you take the splint and the separators off, the bunions tend to recur. So it is just a temporary measure. And generally we use it for people who don't want surgery or people who are unfit for surgery. But by and large, surgery is a recommended choice of treatment. Surgery is generally done as a day case procedure. That means the patient comes into the hospital just for the day. They don't need to stay in overnight. It is generally done under a general anesthetic as well, which is basically putting the patient to sleep. What it involves is, there are various procedures that can be done. It basically is, the basic procedure is to realign the toe. So quite often you need to divide the bone, which is just before the big toe, which is called the metatarsal. And you realign it into a better position. Sometimes once the bone is realigned, it needs to be fixed with screws. Some people use screws, some people use bandages, some use plasters as well. My personal preference is to just divide it and put it in an appropriate bandage. So this bandage or the plaster stays on for about 6 weeks. In the meantime, the patients are mobile, they are able to move around, but they can't go out shopping and driving, etc. So they have to quite often stay at home with their leg elevated so that it doesn't swell up. So basically about 6 weeks in bandages. Then after that, the bandages or the plaster comes off, and it takes a few more weeks to sort of gradually recover for it. So, but once the bandages are off, we normally tell the patients to do whatever they can manage. But by and large, between 6 to 12 weeks is an average time to recover completely from it.